now talk to Hans Cacdac, the administrator of the Overseas Workers Welfare Administration. Good morning, sir. Thank you for taking our call. Can you tell us how many OFWs are currently stranded in different quarantine or isolation facilities in Metro Manila?
Well, good morning, Leah, and to your viewers as well. Well, so far we have around 6,500 OFWs in our hotel quarantine facilities.
And on average, sir, how long have they been in these facilities?
Well, some of them, since the matter between PhilHealth and Red Cross began last October 15, some of them are still awaiting their results, those who at least have arrived last October 15. So they are entering their 8th day today, but most of them are still within the 3 to 7 day range in which one awaits their PCR test results upon arrival in the Philippines.
All right, sir, what are conditions like for them, and what are their sentiments on the delay?
Well, right now they're in hotel quarantine facilities provided by the OWA. Of course, the entire effort is an interagency effort from swab testing to hotel quarantine to transport of OFWs for their home LGUs. But right now they're in hotel quarantine facilities. They're safe and sound in these hotel quarantine facilities. Some of them, of course, have manifested their hopes that the results will be out soon. But in general, they are safe and sound in hotel quarantine facilities.
Sir, could you tell us how much the government has spent for the extended stay and potential continued extended stay of these OFWs?
Well, on average, we are spending around 15 to 16,000 per OFW upon arrival and stay in a hotel quarantine facility. We had not yet assessed the full effect of the delay or their extended stay in the hotels. But let me just say at this stage that with the matter at hand, and with a 3 to 7 days range in which they stay in our hotel quarantine facilities, most of those who had arrived are already at the back end of that range. Meaning to say, when one used to stay for 3 to 5 days in our hotel facilities under the Red Cross, many now are at the back end of the range, which means they are now staying for 5 to 7 days in our hotel quarantine facility.
All right. Do our OFWs have other options? You know, understandably, they have a limited leave here in the country. They want to spend as much time as possible with their families. Are there any alternatives to Red Cross swab tests? And is there a way for them to get the tests and the results more quickly?
Well, right now, as at least 17 government, national and local government laboratories have been tapped. Swab testing continues upon arrival. That's for sure, and it's for free. And the swab testing is undertaken by the Philippine Coast Guard. What has changed is the processing of the specimen collected by the Philippine Coast Guard with their swab tests. While it used to be the Red Cross processing the specimen, now these days it would be the 17 national and local government labs doing this. But the process remains free. Let me emphasize that the swab test remains free, hotel quarantine free, and of course the transport upon receipt of the negative PCR test results, also free transport to their home LGUs. And at this stage, this is the best option that we have. It's still the PhilHealth shouldering the swab test with respect to the 17 government labs. And so at this stage, this would be our best bet, considering the entire process still remains intact, I should say, and still remains free for the OFW.
Right, so it's really just the time factor that has changed. But can an overseas Filipino worker offer to pay or find private suppliers for his or her own test results to come out more quickly? And if that is allowed, could they perhaps be reimbursed for it in the future?
Well, right now, the process that we have is that the swab testing is undertaken by the Coast Guard, and the results are sent to the 17 government labs, national local government labs, available. At this stage, of course, we still want to make the process free for the OFW. So at this stage, we still would discourage an OFW paying for the swab test. because the process, as I said, we still would want to be free for the OFW.
Right. Well, hopefully this all gets resolved very soon for the sake of our hardworking OFWs. Thank you very much, OWA Administrator Hans Cacdac.